Welcome everybody to another Dharma Doctor community call. We're really excited to have you guys all here today. I'm thrilled to be joined by Carly Costello, one of our early partners and adopters of the Dharma Doctor tabs. And we also have Dr. Amy Serin, our Chief Clinical Advisor. And Carly is an EMDR therapist and the owner of the Counseling Nook in West Virginia. She's recently launched her business as an EMDR consultant, building a network of support for EMDR therapists and CEs, both through her consulting and group services, as well as her thriving online community. And Dr. Amy Serin, who many of you know, is our Chief Clinical Advisor, neuropsychologist, and founder of the Serin Centers, and the author of The Stress Switch. So we'll tee things off with Carly, and then we'll bring in Dr. Serin a little bit into this conversation. Really excited to have both of you here today. I think these two women will make for a very compelling conversation for all of you. And as we, kind of dive in to see how therapists can build confidence in this space. So one more fun note, we will be raffling a set of tabs towards the end of this conversation. So definitely stick around. And I'd love to just kind of dive right in. Carly, maybe a little icebreaker. I know that you love to travel. If you could go anywhere, like pick your next dream destination, where would it be and why?
I've wanted to go to South Africa lately. I studied abroad there and turned 21 there. So I'm like, I want to go back. Yeah, so I want to go back.
What did you love so much about it?
I rented a car and traveled the coast. What is it called? The garden route now?
Mm-hmm.
I think that's what it's called. Yeah. I just like the freedom of being able to like rent a car and stop when you want to stop.
Yeah, no kidding. I've never been, but would love to go. So, tell us kind of what inspired you to become an EMDR therapist, and how did you get started in the space?
So I was working on a group practice, and they actually just put me in EMDR basic training. I'm like one of those people that I didn't seek it out. My boss at the time was just like, you're on the list to go to this training. So that's really when I first learned about EMDR. And when I first learned about bilateral stimulation, which is like crazy to me as a trauma therapist. I don't remember learning it in grad school or about EMDR really in grad school. So anyways, that is the first time that I really learned about EMDR is at the basic training. And I really loved the basic training. I'm one of those people that loves the like practicum part, the hands-on parts of trainings. Which I know is sometimes people's least favorite, but it's my favorite and my favorite way to learn. During the basic training, I remember we had to target things ourselves to practice on one another. And at the time I was getting terrible sleep. I had been for so long, just like a hard time falling asleep, and I'll wake up at 4 a.m., just like terrible sleep. So that's what I targeted. And it ended up going to sort of like, I'm alone when I go to sleep. And like, that was the negative belief. And I swear, like ever since then, I have gotten fine sleep. Like sleep is not a problem. So it was because of that I was like total believer. Like I knew I wanted to go far with EMDR, and that's what I wanted it to really be my specialty.
That's amazing. And that was kind of, when was this around? You started like 2020, right?
It was before the pandemic because it was in person. That's how I always remember when it was. We were in person.
Yeah, and what a crazy time to kind of get started in the EMDR space too, around the pandemic. Yeah,
Yes.
Tell me a little bit about that.
So, and then that's the first time that I found my own EMDR therapist was at the start of the pandemic.
Mm-hmm.
And I did it virtual. So then again, like that showed me like virtual EMDR can really be effective.
Yeah. And you had some really good mentors, I assume.
I did. One of my consultants was like the coach at my basic training. She's in Ohio. She's also an IFS therapist. So that's where I was like really introduced into IFS and love her. And then another woman, she's all into neuroscience, like Dr. Amy. And so she's in West Virginia, actually. Yeah.
Oh, amazing.
She was my other main consultant that I had.
So kind of, looking back as how you got started, if you could look back and talk to your past self, is there any advice that you would give at this point? Like, what are some of the most challenging things that you went through as you were getting started?
I think it's just like getting through the nerves at first with EMDR. Like you go to basic training, and then I was so worried that like I could hurt clients, or I could mess them up, or I could mess up EMDR, So I think just to keep going through it and keep practicing and keep doing it, because it really is like the practice is what makes you feel comfortable, and to get good consultation, to have that support.
So would you say that's like one of the biggest things? I mean, having the community, having the support.
Yeah, I think so.
And so that's really what you're building too. So, I mean, tell me a little bit about that. Tell us a little bit about that.
So, well, I originally, when I opened my private practice, like 4-ish years ago, 3 or 4 years ago, I started Instagram, that whole debate, like, am I going to really get on social media for my business here, my private practice? And I did, and it started with the private practice. And then very quickly, like on Instagram, I realized I'm connecting with therapists. That's really who I'm connecting with. So then I made the switch more recently to EMDR with Carly, and really like launching the consultation business side of things. So yeah, that's how
I'm so glad that you did make the decision to go to social, because that's how we got connected.
Yeah.
And I love your content. I mean, I just think you're building such a fun community there.
Thank
If
you.
anybody ever follows Carly or doesn't follow Carly, highly recommend her content. Super inspiring and fun and creative. So I think
My hope is that like I want to just like normalize EMDR, that people can feel comfortable to go to EMDR by sharing even my own experience. Like, I've been to EMDR. So that's like one part. And then of course the other part is to help EMDR therapists feel confident, and really so they feel confident so they can share the power of EMDR with people.
Right. And make a difference in more people's lives. And what does therapist confidence really look like? Like, how do therapists become confident in EMDR when they get started? What are some of those challenges they go through?
Well, I think one big challenge, and maybe this is just like speaking for myself, I have my master's in social work and was very, like CBT, traditional talk therapy, very client directed, very client centered. So EMDR was the first time that I felt like I learned this therapy that was more directive, like the therapist had to be more directive. And so I think that was a little intimidating at first to me.
So can you expand on that a little bit?
Well, just because EMDR, it's more structured, it has 8 phases, there's protocols that you can use. So sometimes at first when you're learning it, it's like you get all this knowledge and information, and you're like, oh my God, but am I doing the right protocol? Am I picking the right target? Am I like leading them down the right path?
No, for sure. And I mean, now that you've been doing this for a while and you're in the consulting space, like, what are some of the things you've learned? Like, how have you adapted your style, so to speak?
Much more fluid. I mean, at first I was like, had all my laminated, all my laminated questions, and to make the treatment plan and the target sequence plan and now it's just more fluid. I realize now, like I said, like, am I leading them down the right path? And there is no right path. That's the whole thing with EMDR, like, trust that the brain will like heal itself, how it's naturally meant to do, and just like let the client process.
Yeah. And there's more than one right path, as you said.
Absolutely. Yeah.
Yeah. I think that's sage advice. So speaking of, wait, go ahead.
Even I was just thinking of like with the bilateral stimulation, like that's another part of EMDR training, like you do 10 sets at this speed and at this time. As a newbie, it's like that feeling like I could mess this up, but that totally gone now. It's sort of like learning how to drive a stick shift. I don't know if anyone knows how to drive a stick, but all my cars have always been a stick. And so, it's like feeling the clutch. And so it starts to just come natural. And, and I mean, like with the tabs now, I'll just like hand them off to my clients, like, hold these, let's talk about this again. Like, tell me about that again. And they're just buzzing. They're going the whole time, So not quite as structured as I was like day one after basic training.
Yeah. And I mean, you blend so many different modalities too. And you pull a lot of somatic resourcing as well, right?
Yeah. And I love like creative drawing, and I love IFS, so blending in parts work.
Awesome. What's one piece of advice from a mentor that has stuck with you over the years?
One of my consultants, she really pushes like don't get too wrapped up in the protocols and just like stick to the standard EMDR, and that it works, and that's why it works. So I think that.
Yeah, so talk to me a little bit about your experience with the tabs. So you mentioned, handing them over to your clients, and I know you and I have talked a little bit about this. Maybe some of the more structured protocols with bilateral stimulation, maybe some people don't do that, but you see the benefit there.
Yeah, so me just personally with the way I use the tabs is more when I do just want to like have constant bilateral stimulation going on. And that's simply because I don't like having my phone out in session to like start and stop the stimulation. So I use it a ton for phase 2, like resourcing anything positive that we're trying to like really cement in to be true for the client, grounding exercises in people that maybe have struggle with focus, ADHD. I find that the tactile BLS can be better, more helpful. Or even like perfectionist clients that eye movements, they might get hung up on like, am I doing it right? Or so that's another time that I use the tabs. I also like that they can shut their eyes. It can help with imagination, with imagining things.
Yeah. Do you find that a lot more of your clients prefer like the tactile over the auditory visual? What do you do most?
Definite. I really do mostly either the tactile or eye movements. And I do think clients like the tactile. I definitely think they like holding the tabs more than tapping on themselves.
No, for sure. That's definitely hard to keep up with.
Yeah,
In your head too, trying to stay focused in a session like that.
on yourself.
Yeah, exactly. I think it would be a really interesting time to, kind of bring Dr. Serin into the conversation for this piece too. We had spoken a bit about the differences between visual, auditory, and tactile stimulation, and kind of some of the research that's out there even that indicates, how they have very different effects in the brain, the body. In some ways. Dr. Serin, you want to jump in?
All right, so I get to nerd out now. That's great. And hi, Carly. It's so nice to meet you. I'm
Yeah,
taking notes because I love a lot of the things that you're saying. So I love these intuitive therapists like you because you figure things out on your own. You haven't looked at the NIH research maybe because it's all embedded and it's buried. But really, the auditory cortex is not organized the same way as the somatosensory cortex. So tactile stimulation has a much different effect on the brain than auditory stimulation. And I know there's an article on like the idea that bilateral stimulation taxes working memory and that's its mechanism of action. I am not a fan of that interpretation, just FYI, because having done a lot of EEG research on what the tabs are actually doing, you can see the regulation in the networks. So one of the intuitive things that you've picked up on, Carly, is, yeah, my patients with ADHD, they seem to do better with the tactile stimulation. Well, we did a study where we found that about 50% of kids with ADHD, that bilateral tactile stimulation helped their attention in about 50% of the kids. Attention, hyperactivity, and impulse control, and everything else. Then we know that just the stress relieving properties of bilateral stimulation is so profound that another intuitive thing you're doing is expanding the use of bilateral stimulation, like in all the phases of EMDR. So I do the same thing. Like when people walk in and before they even tell me their history, I'm like, I'm going to put these in your hands and we figure out which frequency kind of works for them. And then while they tell me, because my thing is, why would I make them, we're all like paranoid, I think, as a field of dissociation and flooding, right? Like really to the extreme. So why are we're so afraid, and we're so afraid to dig in with EMDR, which is really the active ingredient of helping people process. But then we're just going to let someone for an hour come in and tell us all their trauma and what's been bothering them without any help with their nervous system regulation, send them on their merry way and say, come back for an hour next week. It doesn't make sense. So I've expanded the use of these in phase 1, even where we're not trying to actively process. What we're doing is recognizing that tactile bilateral stimulation the tabs is desensitizing a stress response, no matter what someone's thinking about, talking about, whatever. If their stress switch is high, it's probably lowering it unless it's on a frequency that's agitating. And that's really quick. You can really hone in on that quickly and slow it down or speed it up for somebody. So I love all the intuitive things that you're saying in terms of really just kind of recognizing based on your patient's responses, like, hey, I'm going to expand the use here, or I'm going to help my patients with ADHD or perfectionism and note that it lowers that and it helps them. With regard to perfectionism, we know that there's a lot of fast wave activity called beta and high beta that occurs in the brains of people that are very driven and focused, but, you know, sometimes stressed out, right? And like, I'm not going to say whether or not my brain started off that way or is still that way. That's another conversation, but I understand this phenomenon very well. So we know that using the tabs lowers beta and high beta activity in the brain if there's too much of it. It doesn't take too much away, right? We're not introducing a chemical or something artificial that can go too far. It's just a natural way for the brain salience network, particularly via the thalamus, to calm down the stress switch in real time. So I would advocate that for the therapists who, you know, well, all therapists really think about just kind of expanding the use. And Carly, I know you train a lot of new therapists, right, as a consultant, and that's just awesome. But it's funny, we'll do these things for our patients, that we don't do them for ourselves. I mean, I think that therapists, especially in training using bilateral stimulation, can really benefit from collapsing that curve of, if it takes a normal therapist, you know, X number of, you know, sessions or years or whatever to feel confident, I think we can cut that time down just by lowering our stress switch as we're learning and using these tools for ourselves, and really getting away from thinking that tabs have to be used in EMDR protocols. They can just be used out and about, you know, while people are going about their day, when they're in a prolonged stressful situation, really as a tool for regulation. So I know I said a ton of stuff, but I was just excited while you were talking. So there it all is.
I think that's great. I mean, Carly, I know that you use them as well personally, so you can
Oh
definitely.
yeah, I'll throw them in my purse to take them home, or take them to my sister. That's super stressed.
Right?
Was
Every
using them
time
before this.
carry them too. And whenever I don't have them, something inevitably comes up. And I'm like, dang, I should have, you know, brought them. Like, I usually carry them on airplanes, especially because I'm the one, I've Murphy's Law of like the anxious passenger next to me freaking out, right? And I literally gave them one time to a man who was so petrified of flying, but they had some kind of a family emergency or something. He had to fly, I forget why. And his partner was just like, I'm so sorry. Like, let me apologize for my partner who's like freaking out next to you. And I'm like, well, do you want to hold these for me for a minute and they might help? And he's like, sure. Grabs them, holds them. And then within 5 minutes, he was asleep. And his partner's
Wow.
like, oh my gosh. And then when he woke up, they were talking about, he's like, if I feel like this on an airplane, I think we can go to the Bahamas, honey. Like, it was really taking a toll on their relationship because of his fear of flying. It really is that. So, Carly, when you have the experience of like, okay, I did one EMDR session in training and now I sleep. I think one of our hurdles as EMDR therapists is that nobody believes us. Like,
I know.
you know, like it's unbelievable, sort of, but we're all sitting here going, no, 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 I've seen this a billion times. Like, this really is, it
And
really is good.
I do think a lot of EMDR therapists get hung up because they feel like I need to explain to my client first, like the science behind it and why it works and how it works and step by step. But I'm like, no, just say like, this has worked for me. It might sound hokey pokey. Let's just try it, you know?
Yeah,
I think
yeah,
that's
because
true.
they really want relief. And
Yeah.
I do get pushback when I'm training sometimes. Well, like, we need to build rapport through talking and through explaining and through this. And I'm like, look, my patients pay a lot of money because we're cash pay practice to come in here. I don't want anyone wasting 1 minute of time. They really want relief. And do you think that if you give them immediate relief and something that works, and that their introception, when you ask them to tune in, they perceive a difference right away, and they start breathing again, and their stomach ache goes away, and their chest tightness lightens up? Do you think that that is another way to build rapport? to just be so effective so quickly that they're getting relief. Why would I talk to them about their dog for 20 minutes to get them comfortable? I can get them comfortable in 30 seconds with tabs. So that's just kind of my bent on it. Yeah.
I think too, it's whether you're in EMDR therapy or outside of EMDR therapy, I think it's about giving people the tools that they need to stay grounded. And whether that is, during a session when their anxiety or stress is up really high, or that's, hey, these are some of the things that you can do between session to calm yourself down, whether that's tabs, whether that's getting outside in the sun and grounding, and whether that's petting your dog or spending time in your community. And so we want to give people the resources and the tools that they need to effectively downregulate that stress switch. And so in an EMDR setting, certainly it has that effect as well. Carly, I know that, you've seen that with your clients, but what are some of the ways that you manage your own kind of stress, and how do you stay grounded in all of this?
Well, I do use my tabs. I do like to get outside a lot. Yeah, I garden, try to garden. I love mowing the grass. I like manual labor.
Too.
I just repainted my door 2 times. I'm gonna, repaint all the cabinets in my kitchen. Like, I like seeing a finished product.
Yeah.
That's why I love mowing the grass.
Yes. Instant gratification, that we.
Yeah. And like mindless, like while I'm doing it.
Yeah, completely. And how do you like relay this to either the therapist that you work with in your practice, or, to some of those in your community? Like, what is your advice for them to stay grounded? What have you heard that's worked as well?
I guess all the all the typical things, working out, yoga, self-care stuff, go to therapy.
Mm-hmm. But you're an Enneagram 7, so I think, that's
all so fun. So you're the one we want to go to happy hour with then.
Yes.
7s are the fun. 7s are the cruise directors and the fun ones.
Yes. Thank you for acknowledging that.
Yeah. No, my mom's a 7, and I swear without her, I would just be working all the time and just completely not boring, but just
Are you
like
a 3?
not. I am a 3. Yes, you've pegged me. I'm actually okay. I'm a 3 and a 2. Depending on when I take the test, it flip-flops 3 and 2. So they're both like right up there. And I
3 and a wing too.
Yeah, probably. But I think I'm probably more of a 3. Like on Myers-Briggs, it's ENTJ/ENFJ, and it goes back and forth. But I think at my base, I'm probably more of a 3. Yeah.
Yes. I am a 7, which the downfall of a 7, and you don't know, it's like the personality test, and it's called the enthusiast. And I need to have happy feelings and experiences to avoid painful emotions. So that's like the downfall, is that sometimes we can like pack our schedule so much to avoid being bored or feeling lonely or sad or whatever it is that we're trying to avoid.
Mm-hmm.
I think it's kind of beautiful though, and thinking of that layering on of the 7 with doing EMDR, because especially when you expand it with the use of the tabs, you're really collapsing the painful emotions so quickly. That isn't that perfect for a 7? Like, I'm getting you over this so much faster. And now we can go, now we can open up to like joy and fun and all these other things. And so instead of needing to like avoid it for your patients too, right? If that's a tendency at all of 7s in general, maybe is like, I have this ability now and this tool to like really, we don't have to glaze over it, but we can deal with it so quickly that then all this other stuff opens up. And that's where I like to live,
Yeah. I never thought about it. I think that's probably why I love EMDR therapy as a client.
Yes.
Like, I can have one real good EMDR session, bawl my eyes out, and we are good to go.
Yeah, I think that's part of the unbelievable part for people when they're learning EMDR, or if they haven't experienced it as a patient too, is just what the resolution really looks like. That it's like it's like a wall between what's happened, or it feels like this memory feels like a hologram. It feels like neutral. And then all the stuff that you're doing unconsciously as a result of it that we can't even figure out, right, until it's done. And then our behavior spontaneously changes. All of that shifts like that. And I think that's the magic of, of the EMDR, and especially I find when we're using like the tabs in between sessions for people. Before I knew to do this years ago, people would come in and they would, we'd get them from a 7 to, let's say, a 4, right? And then they come back the next week and they were at a 4, and then we'd work. But now they'll come a 7, we'll work it down or whatever, and then they're using the tabs in between sessions, and then they come down and their suds are actually lower because they've been systematically desensitizing things, not even consciously, and not because they're trying to do EMDR on their own, but just because they're getting a therapeutic effect in between sessions just from the use of the tabs. So I think that's pretty great too, especially for those 7s out there that want to be focused on the fun, and the good things in life. Yeah.
I was just thinking of a question I want to ask you.
Yeah.
Because, with EMDR, we explain about the bilateral stimulation, this is how it's going to work. And then everyone's like, okay, but like, why? Like, how does it work? Can you give me a very more simplified answer of like bilateral stimulation?
Yes. Okay. So there's a really great article in Wired magazine that came out in April. And if everybody wants to Google it, or maybe Michael has it and can put it up on the chat, it's scientists have finally found like the area of the brain that regulates consciousness, right? Okay. Now, what area do you think that is? And I'm with you on the front. Yeah, no, actually. And I knew this, right? We knew this. I know, but that's what we've been taught. Okay, it's the thalamus. And if you know what the thalamus does, we used to think it was this passive relay station of it's incorporating all the senses except for smell. Smell's different. And then consciousness is coming and going, okay, what am I going to do with this information? But no, the thalamus is the decider. The thalamus is part of the salience network. And what it's doing is it's taking in the sights, the sounds, the touch, the signals from inside the body, and it's deciding what you get to pay attention to. It's the decider. Plays a very active role. So if we add whatever inputs we add that the thalamus is like deciding about in the moment, it alters that decision, and then it alters consciousness. Now, when we pair that with I'm actively thinking about a traumatic memory, and now I'm adding a sensory input into the thalamus, then it changes the brain's equation. So if you think about a trauma that you've been through, right? And every time you think about it, we've got like a file clerk, and she's like, okay, it's a 7 out of 10, and you feel it in your stomach, and you feel like are powerless, and you feel sad, right? And that's kind of the template. And then I go, that's too bad. And then I go take a yoga class, and I take a bath, and I come back, and then I think about it again. It's going to be the same. I mean, I feel better in general, but that trigger, it's going to be a 7 with this body sensation and this. When we pull it out, though, and we use the tools of EMDR, we're actually changing it. But what we found is, and that's a pattern interrupt, right? But what we found is that if you're thinking about a trauma trigger, or if just you feel stressed and you don't know why, and you just add the tabs, even without active processing, it is going to actually pattern interrupt that if you do a couple of quick things. And so it won't be a 7 anymore. And so that's what we're really going after. But really, I don't know. You asked for simple. Simple's hard for me. Sorry, everybody. Neuroscience is complex. But the main thing is we have to unlearn some things. So stop talking to me about the right hemisphere and the left hemisphere and like bilateral stimulation activating the hemispheres. I don't care. I care about the networks of the brain and what they're doing in real time as a response to what you're doing, and whether or not you're getting a pattern interrupt. And if you can do that, that is the basis of all healing. That's what you're really doing.
Pattern interrupt is the
shift. Well, the pattern interrupt is the shift that you get in what your brain is automatically doing in response to a trigger. So if you think about a target of EMDR, every time I think about it, my SUD is 7. I feel powerless. I have this. If I can do something in real time that changes that, and then the next time I think about it, spontaneously, my brain doesn't go up to a 7, my SUD is lower, that means you got a pattern interrupt. Now, the tabs will produce a pattern interrupt. Okay, and one of the ways they do this is because they work so quickly. So it's basically a paired association. It's like operant conditioning for your brain. So you know how like Pavlov did the dog, and he's like, rang a bell, and he gave the dog meat powder, and dog would salivate or whatever. And then eventually he'd ring the bell and the dog would salivate, because every time the bell and the meat powder were together, it produced a response. So now one of these things is going to produce a response, right? If we take a trauma and activate it, I mean, think about it, right? And really think about it. We feel the body sensation and we, the stress goes up in our body. And then we introduce something that lowers the stress immediately. That's the new paired association, is this is how I feel when I think about this. And that now is the new pattern.
Man,
Wait, go ahead.
this is why people should buy tabs to have all the time, because that's why, like, the guy on the plane, like, super anxious flying, he's literally on the plane flying, give him the tabs so that now
and now that's the pattern interrupt, right? Because now it's like, wait, if I feel like this, I can fly, because really he's not avoiding the planes, he's avoiding the anxiety that the planes trigger. And if we can have him on a plane and anxiety, I mean, this is the basis of, if anybody's ever done systematic desensitization or like exposure with response prevention for OCD and things like that, or phobias, this is the same kind of principle. It's just we can collapse this. So, I used to use new exposure with response prevention for OCD, but back in the day when we had wired versions of this, we would put them in hip packs of people and I'd have them hold them while they were doing it. And I learned that it didn't take me 12 sessions to go through the protocols anymore. It took me like maybe 3 or 4, because the whole point is to reduce their anxiety with the exposure of the anxious trigger at the same time. And then over time, the brain, that's the pattern interrupt. And so if I can get that down real quick physiologically, then I can collapse that treatment plan by, 2/3. Yeah. And I'm curious if anybody wants to, add in the chat, or if you have more questions, because I know this is a Stroop effect in the brain where we're trying to pattern over what we've learned. It's like, have you ever seen that neuropsych test where, the word red is the color of it is yellow, and you're not supposed to say red, you're supposed to say what color it is. So you have to say yellow. That's a Stroop effect. It's very, very difficult to do, because you have to rearrange what the automatic tendency is to do. So all of you have learned erroneous things about neurology and how the brain functions, and we've got to learn over that. That's different than just learning it like this for the first time. But all of our neuroscience points to the salience network, the thalamus being a part of it. And, the amygdala, okay, great, right. We know what the amygdala does, but it doesn't do everything that you say, and it doesn't operate in a vacuum. It operates as part of the salience network. So that's the key here.
I like that explanation of the red, but it's in yellow. It's like good to explain even like our goal in EMDR, like with rewiring.
Yeah. And when you think about what rewiring is, it's really just not having the same automatic reaction to a memory or a thought or a trigger or whatever. We want to go for the automatic functions, everybody. We don't want to keep going the slow road. Like, this is what, like, behavioral stuff and training habits and willpower and mind over matter and all that. It can work, but it's really slow. And a lot of our positive outcomes are, okay, I'm still getting this automatic reaction and now I'm coping with it better. Well, I don't want that bomb to be detonated and then you have to deal with it all the time. To explode. Let's get rid of it. And then there's nothing, what do we have left to cope with? Right? So I don't like it when coping is the goal, and I want a fast resolution. And the tabs, when I invented the first, wireless devices, it was really because that was the fastest thing we could find to help people, post Ebola, to not have PTSD and things like that. It was the least expensive, fastest, most effective thing that we could alter the brain and its function to prevent PTSD and to lower the stress in real time. So it's just profound.
Can you tell me if this is true? Because I've said this before. Yeah. So a lot of therapy, it's teaching us how to cope when we're outside of our window of tolerance.
Yeah.
Cope with it and how to get back in as soon as possible, But EMDR therapy is one of the therapies that actually expands our window.
So I look at the window of tolerance a little bit differently, because it's kind of like saying, like, if you think about your stress switch, like if my stress switch is 7 or 8, I want to be able to handle that and cope with that. Well, if it's a 7 or an 8, your body's inflamed, your cortisol's high. Like, I would like to take away the 1,000 things that bring your stress switch up to an 8, So rather than tolerating an inflammatory condition for your brain and body, I would like to create the conditions within an organism in a person to where if they're not constantly going outside of a range of healthy function,
Regular
right?
trigger,
They're
right?
not regularly triggered. Now, if someone's triggered, we want them to bring that stress switch down as quickly as possible. But I don't want to do that with things that require them to leave their work. Like all these IEPs for kids, right? Like for anxiety, it's like leave the classroom, go self-soothe, whatever. I'm like, how about they stay in the classrooms and pop the tabs on and they don't miss an hour of instruction trying to self-regulate? We can bring self-regulation instantly. So my thing, instead of coping, is let's bring them back into the window of tolerance, right? And it doesn't mean that we're not training resilience, because we're actually training the nervous system to be regulated and healthy. And then all of those other strategies of resilience can work in that mode. Because you think about like all the things we teach people how to be resilient, they totally break down when you're in fight or flight anyway.
Mm-hmm.
So we have to get people out of fight or flight.
All right, guys. So I want to make sure that we leave us enough time to kind of, dig into some things. You've got some questions for Carly, Dr. Serin, or myself about the tabs. I would love to chat and hear from you guys. I'm also really interested to know, how many of you are actually using the tabs now or maybe new to them. So feel free to pop your questions in the chat or join us on video and just, join in the conversation. And then we'll have the drawing here soon as well. All right, Carolyn, go ahead.
Hi, so this has been great. Thank you so much for hosting this. This is, like I said, been really great. I've got a question because I intuitively want to put the tappers in at intake, right?
Yeah.
And I am working with these tappers now, and my clients love them. They love the feel of them, and everybody wants to take them home, and so we're ordering them. But my question is, like for intake, do you find, is there a particular intensity that works best?
Yeah.
Yeah.
Yes. So on the pre-settings, the blue, I start with blue. And
Okay.
there's actually a rubric and an algorithm that's on the Dharma Doctor website, right, Michael? That's like how to actually go through. But I start them on blue, and then
Okay.
I do like a quick interoceptive, check on them. Like if you're thinking of one of the reasons why you're here, what's the SUD, where do you feel it in your body, and then put these on, and then we're gonna find your frequency first, right?
Okay.
See if you're a freak like me, right? FQ. Isn't that cute, Michael? Okay, you can have that for marketing. No, I'm just kidding. If you're a freak like me, hopefully not. But then if they say, okay, if I'm a 7 and okay, it's like maybe a 6 or still a 7, after about 30 seconds, you go, okay. And then I slow them down to the green, right? And then I play with the intensities, and then the fewest amount of people will respond to the kind of magenta one, the fast one. People who are very smart, very quick, very whatever, or very angry, that's usually the mode where they like those. But I find that you should get at least a 3 or a 4 sud drop, unless they're starting from like a 4. It will only go down to probably like a 3 or a 2, and that's fine. But if they're 7, you should be able to get them down to like a 4 in about 30 seconds. And again, there's a rubric for that. But most of the people, I've done it with thousands and thousands of people, like most people will respond to blue. And it's not just person specific, it's situation specific. So sometimes people will, like, if I'm want to go to sleep and I notice my monkey mind's going, I like the green presetting, kind of that slower whatever. But just during the day normally, just to kind of get my stress switch a little bit lower, I prefer like that blue setting, which is a little faster. And then when you're using the app, you can get real nuanced with it. But the key is to ask them to rate their SUD and do it. And I have a technique that we're launching. It's called neurosomatic reset technique, and it actually front loads desensitization before you get to phase 4 in EMDR. So what you do is you use the tabs, you take like 10 or 15 of their targets, get all their SUDs, and then you use the tabs with a quick method, and you can get most of them down to 4s or 3s. So then when you start processing in phase 4, you're starting from a lower SUD number, which is great because then it's going to prevent that flooding. And the things that we're so worried about.
That's
Carly, yeah. Carly, what are you finding when you're kind of calibrating these and finding what people
I'm
like?
The tabs in the intake, I definitely do blue. I just stick to blue, the slowest.
Mm-hmm.
Pretty much, I love doing some sort of bilateral stimulation the very first session, especially if people are coming to me for EMDR therapy. Because I'm like, Dr. Amy, I just want to like jump in. So, but I do slow because I feel like it's a winner. Like,
Yeah.
I want you to feel good. I want you to feel good this first session. And then I know you're going to come back and you're open to EMDR then.
Calming.
Yeah.
Yes. Yeah. And actually, just want to go through because Carly, you said blue is the slowest, but actually on the presets, green is the slowest, and then blue is the
Oh.
second one. But blue is still relatively slow. I was just checking that because I want to make sure I didn't get it.
So we have our manual mode with the tabs. So you can use them in manual mode. You can also use them with the app. So in manual mode, you're going to have 3 different speed and intensity settings, or 3 different speed settings and 2 different intensity settings. So you can toggle between the green, blue, and kind of this fuchsia color. And then 2 different intensity settings. Each of these actually have little buttons at the bottom. This little Dharma Doctor symbol, little flower symbol at the bottom, is actually something you can squeeze. Realizing that some of our customers actually didn't realize that, so we're trying to make sure that everybody knows. But we have up to 10 different speed and intensity settings available in the app. So just wanted to kind of clear that as well. It's really nice to have that, super convenient to be able to use them in either mode. Now we have some questions here I just wanted to check out. See here. How do the tabs differ from plug-in hand sensors other than being wireless? From Susan. How do they differ?
So Susan, so there's a lot that are coming on the market now and everything, and the vibration matters. So there's some ones that are like more of a hard tap. Okay. And that is not effective as a smooth vibration. It also matters when the vibration stops and ends and relative to the other one. So when we're doing the EEG research, we can really tell a difference between the mode. So if some of you have the old neurotech ones too, you'll know that there's buzzers that light up, and then there's the ones that are gray and black that are just kind of hard. The buzzers that light up had sort of a shaky kind of vibration. They're not as effective as lowering stress as the ones without the lights in them. So it matters. But other than the plug-in hand sensors, you want to make sure that it's a smooth vibration and it's the right frequency for people. But other than that, there's probably some other nuances, but I'm not familiar with all of the different.
I was going to say that, also with the tabs, we've got a rechargeable case. I know that most of the sets that you guys are working with do not come with that. We've got a rechargeable case, up to 3 different charges within the case itself. So that makes it super portable. So that's also another added feature. Also, the sleeves that are on the tabs themselves, you can actually take these off and clean them.
I did not know that.
Yeah, we've actually, Brad has talked about maybe having some fun colored sleeves at some point. So we'll see what we can do there. But yeah, you can actually take these off. Super easy to clean. And yeah, we have some new features that are coming out here soon as well. So we'll kind of keep you guys posted on that. But if there's anything you're missing too, I mean, what are you looking for in a set? Let us know, because if we don't have it, we will definitely try to build it. Let's see, what if someone wants to use the tabs during an activity which requires using their hand and they can't hold the tabs? Well, you can actually place them in different areas. For me, as a woman, I like to put them in my bra straps, honestly, or in my front pockets. If you're a guy with a button-up shirt, you got some pockets, you can put them in your front pockets. Key is to not have them on either side of the body. That can break the Bluetooth signal. We're working on that, but in the meantime, that's really the only hindrance that we've seen, is having them on either side of the thighs and enclosed in the hands. That's really the only hindrance. So I wouldn't put them in the back pocket and sit on them. Maybe front pockets, front shirt pockets, bra straps.
Socks, like on the inside of your ankles, you can do that. And it's funny because I can have women hold them like this and be fine. But if I've got a guy with like big meaty hands, then that sometimes will block the Bluetooth. But yeah, as long as one's on one side of the body and one's on the other in a relatively the same space, and people will be like, oh, what if they're a half inch off? It's fine. It's somatosensory soup. There's one, as long as it gets in the pot, it's fine. So it doesn't have to be perfect in terms of where it is on the body. It can be a little bit off, but generally in the same place on either side. Yeah, but without the body blocking it. And this is helpful because a lot of times people want to use these outside of session while they're in a prolonged stressful situation. So I was just you know, like if I'm having I don't really have tense meetings, but let's just say I am, and it's like an hour long or something, you want to have these. Or we've actually sent first responders who have been in critical incidents into court, and they have them on the whole time because like they're literally afraid they're gonna jump up and attack, you know, the person that shot their partner, for example, and they have to testify and, you know, watch them live for, you know, an hour of testimony kind of a thing. So in these situations, or if you're giving a presentation or something, if you get difficult news, this is one of the big things, like right away. I mean, I got some bad medical news a few weeks ago about one of my kids. And I mean, I used them the entire day and then did self EMDR. I'm allowed, right? Because I'm a therapist, and it's also in Francine's book, but did self EMDR, you know, pretty much for a couple of hours before that night. And then I didn't develop all of the stress, you know, PTSD kinds of stuff afterwards. It sort of right sized it in my brain. But really, we want to get immediately in after something. And then the doctor can't make this claim, but for pain, like I've got a patient I'm working with right now with very painful cancer, and he just has 2 sets and he cycles them because he does not want to be without them while they're charging. So he has 2 sets and cycles them, and he literally wears them all day. And it's really, really helped him cope with and manage pain, lowered the amount of pain medication that he needs, which could complicate his conditions. There's all kinds of, you know, off-label uses that are really, really great.
Hey guys, so I want to go ahead and jump to this raffle, but I also just wanted to give you a chance to really speak about what you're doing with the EMDR for Carly. Tell people how to find you. Also, your
Yes.
cohort coming up.
Yes, I have a certification cohort coming up and a CIT group for CITs. So it's my first time doing these 2 programs, and they're like both cohort style, both start in August. So yeah, there's 4 spots left for the certification and then 2 for the CIT group.
Good for you.
I know. I'm really excited. And the CIT collective, I'm sort of taking, like, I've done a lot of like business coaching masterminds. So I'm sort of like taking all of that and combining it into the CIT collective. So not only do you get your consultation hours, but you also get like the business side of things. And there's 2 spots left in the CIT collective. Rebecca.
Awesome.
Great. That's great. And Carly, are you going to be at EMDRIA?
No, I was just looking at that.
Bummer.
We'll
be there.
My daughter, I haven't been away from my daughter yet. She's like 1.5.
Oh, okay.
Yeah. And we're still in the nursing phase. God only knows when it's going to end.
Yeah. Well, no need to rush it for sure. That's great.
Yeah.
All right, guys, let me run this drawing real quick.
What a cool wheel you have.
Yeah, I know.
All right, Brandy.
Congratulations.
Brandy still with us?
Yeah, that's exciting.
You're welcome. Yeah, I'll shoot you an email after this. We'll get your shipping information and get those out to you. Congrats. Thank you guys so much for joining us today. Any closing thoughts, Carly, and Dr. Serin?
No, stay in touch.
Yes. Thank you all so much.
Just love everybody that participated. Thank you so much for being here and for your interest and for being lighthouses for other people, because God knows the world needs it. So thank you.
Yeah, absolutely. And everybody, if you have any questions about the tabs, I heard a couple of you may even be interested in carrying them. Please reach out to me. I'll be available through Michael at dharmadoctor.com. I'll shoot an email to you guys. And yeah, we look forward to having you back hopefully next month. Thanks so much, everybody. Have a good one.
Bye. Thank you.
Bye, Carly. Thank you. Thank you, Dr. Serin.
Bye.
Thank you.